How's it going, guys? Past level question, ophthalmology, step one, internal medicine, family medicine, TCK. You have a 6-month-old boy who clearly has retinoblastoma. We're handing you the diagnosis, leukocoria. Okay, you got the white eye reflex, or you could say the absence of the red eye reflex. So this isn't hard. Now, the question is, well, OMG, what are you going to see in this patient? But it's not dramatic, and I've made prior YouTube clips on this. So choice A activation part of oncogene, wrong fucking answer. So congenital retinoblastoma, RB gene, it's a tumor suppressor gene. So we're just talking very basic stuff here. So tumor suppressor gene means you have to have a double knockout, and the gene normally, well, you would never have guessed it, suppresses cancer. So if you lose two of those alleles, then cancer can develop. In contrast, an oncogene is where you only need one to be activated. Okay, so if it's activated, it now sets off the growth of cancer. Okay, so there's nothing about tumor suppression. So proto-oncogene, I'd say high yield ones for USMLE could be BRAF for melanoma. It's actually not even really high yield, truthfully, but it's like a notable one you could discuss. BRAF for melanoma, and I'd say RET, proto-oncogene, for medullary thyroid cancer, MEN2 syndromes. Wrong fucking answer. Choice B, autosomal recessive inheritance, wrong fucking answer. So congenital retinoblastoma, even though it's a tumor suppressor gene, and you're going to have one hit that's inherited, and then at some point, usually in the first year of life, you're going to have a double hit, and you're going to develop the retinoblastoma. This is an autosomal dominant inheritance, okay? Because it's basically a 100% chance that if there is a mutation inherited, the child is going to develop it, okay? So if you Google this, they'll literally be retinoblastoma. Is it AR, AD? It's AD. Wrong fucking answer. Choice C, development osteosarcoma, correct answer. So for some of you, you're not happy today because this is too easy for you. But for some of you, you're like, really? Never heard of that before? Okay, well, you need to know that retinoblastoma mutations, not only do they lead to congenital retinoblastoma, but also osteosarcoma of bone. Not dramatic, but you should know it. So the three demographics for osteosarcoma: number one, idiopathic, males generally 15 to 35. Number two, congenital retinoblastoma. So let's say they show you this picture, and then 15 years later, you just need to know that they can develop the whole Codman triangle, sunburst appearance. Okay, you can get increased ALP as well. They can tell you that there's a periosteal reaction. These are buzzy descriptors for osteosarcoma. So that's the second demographic. The third demographic is usually elderly with Paget disease of bone. Okay, that's for osteosarcoma. So let's just quickly whip through the finalist choices here. The development of Paget disease, or Paget, wrong fucking answer, usually a male over 50s. This is just going to be a primary disorder of bone where you have increased bone turnover. That's how they can write the answer. Increased bone turnover. So you have mixed osteoclastic, osteoblastic phases. I'd say 14 out of 15 questions, you're going to have an isolated increase in serum ALP. Okay, so calcium normal, phosphate normal, PTH normal, ALP alone is high. 14 out of 15 times, okay? So buzzy things like hat doesn't fit the dude anymore, get tinnitus due to narrowing of the acoustic foramina. And actually, before I go to choice C, you should be aware of intraosseous AV fistulae leading to high output cardiac failure in Paget. Wrong fucking answer. Choice C, insufficient hexosaminase A activity, garbage answer. Choice, wrong fucking answer. Just being an asshole, okay? I mean, students don't know what's going on. They choose weird sounding stuff. This is just Tay-Sachs, right? So it's a pass-fail step one. It's nothing you have to get maniacal over. But Tay-Sachs, deficiency of hexosaminase A, buildup of GM2 ganglioside. Okay, it's just a neurodegeneration or neurodegenerative disorder. It can give you a 2-year-old who's had blindness, worsening vision. They can tell you there's a cherry red spot on the macula, that there's no hepatosplenomegaly. Niemann-Pick, in contrast, you also get cherry red spot on the macula. There is hepatosplenomegaly. Okay, Niemann-Pick, of course, sphingomyelinase deficiency, buildup of sphingomyelin. Choice C, wrong fucking answer. You know the deal. Until you make more content, like my subscribe channel. Appreciate your time. That's it.